all the CAR T-cell therapies have been transformative in patients with lymphomas, multiple myelomas, and limited in leukemia, primarily ALL. The CAR T-cell therapies have not worked that well so far in solid tumors. So I think next decade is going to try to focus on how can you improve the CAR T-cell therapies in solid tumor oncology. In heme malignancies where CAR T-cell therapies have worked very well, there is still a significant delay between getting the CARs ready and infusing the CARs. And so typically, if you look at most trials, the average time between the production and infusion, there's a delay of anywhere between 3 to 4 weeks. So just to give you an example, I talked about Zuma 7 and Transform, two trials which have put XC-cell and Lysocell as an option, both positive trials, when it was compared to standard of care with salvage chemotherapy. But there was 26 days, which was the time it took to infuse the cells in patients in Zuma 7, and 36 days for Transform. And so one of the big focuses now is how can we get these, maybe even the off-the-shelf CARs, where we can transfuse this much sooner. Because again, when people are in refractory or relapse stages, these patients tend to progress pretty quickly. And as a result, anywhere between 5 to 8% of patients even progress before they get these CARs. So the question is, if you want to make it available to all of these patients, we need to find a way to shorten this manufacturing process time and then giving it back to patients. The second also is how do we get better in terms of management of several toxicities of CAR T-cell therapies, which include cytokine release syndrome. There is, obviously a fair amount of neurotoxicity. And I think most programs are getting better in terms of how we are managing these patients with multidisciplinary teams. So having neurologists on the team, which have a special experience and expertise in managing the neurotoxicity, for example, of the CAR T-cell therapies becoming an integral component. So I think in the next several years to decade, we'll have better CARs, we'll have more targets. We will see a CAR T-cell therapy in solid tumor oncology. We'll hopefully see shortening of the transfusion time and better management of the toxicities. So it makes me really excited as a physician scientist involved in designing some of these trials about the potential of how can we further transform the outcomes for our patients using these kinds of therapies.